In the fourth section of our lecture, now we will discuss the epidemiology of acute infectious diarrhea. And in the epidemiology, we will talk about the travel history and location, age and host immune status, bacterial food poisoning. So all that we will discuss in section 4 of our lecture. So the travel history, as I kept on mentioning off and on, travel history is very important to ask if the patient has acute infectious diarrhea. The Campylobacter jejuni infections are common in Asian regions. So people who are traveling from America, Europe, other Western countries to the Asia, so they should have the travel history is important, and usually they should get the vaccination before they travel to the area where these diseases are endemic. So common in Asian region. Sudden onset of abdominal cramp, anorexia, watery diarrhea, most common travel-related infections. So these are the travel-related infection is due to the Campylobacter jejuni infection. That's the microorganism that is commonly associated with the traveler's diarrhea, and the person usually have sudden abdominal pain, anorexia, loss of appetite, and they have watery diarrhea, which is the traveler's diarrhea. Again, travel history is important, and then let's go over some etiological agent associated with the traveler's diarrhea, some comments, and about how much percentage of cases associated with those microorganisms. So bacteria, we have enterotoxigenic E. coli, and commonly bacteria are 50 to 75% of the cases of traveler's diarrhea are bacterial in origin. So 50 to 75, a big number, mostly is due to bacteria. And common bacteria, we have enterotoxigenic E. coli, 10 to 45%. A big number is E. coli, single most important agent. Then we have entero-aggregative E. coli, 5 to 35%, emerging enteric pathogen with worldwide distribution. So E. coli are very common in travel diarrhea. Then Campylobacter jejuni, 5 to 25%, more common in Asia. Shigella, 0 to 15, again major cause of dysentery. If dysentery is present, the first thing is Shigella. Salmonella, and then we have some others including Aeromonas, Plesiomonas, and Vibrio cholerae. So all these are the different bacteria. Then we have viruses, are norovirus, rotavirus, and associated with cruise ships, particularly common among children. So mostly are bacterial causes, about 50 to 75%. Remaining, you can see 0 to 20 is viral. Then we have parasites like Giardia lamblia, Cryptosporidium, Entamoeba histolytica, Cyclospora. So all these are the different parasites, and they affect hikers and campers who drink from freshwater streams. So different type, depending on what type of traveler is it and what is the purpose of travel, different microorganisms are important. Other, we have acute food poisoning, 0 to 10, no pathogen identified in 10 to 50% of the cases of food poisoning. So again, very, very good, important chart comprehensive chart that gives you all the information on one side that are the organisms which are associated with travel diarrhea. Location is important. Outbreaks of enteric infections in closed and semi-closed communities. Norovirus, highly contagious, commonly associated with acute gastroenteritis. So in closed spaces, closed communities, usually the norovirus is involved, and that is highly contagious. Other common organisms spread by orophycal contact: Shigella, Clostridium jejuni, then we have Cryptosporidium. These are all the common microorganisms that can be transferred from the fecal-oral route, and they are in the closed and semi-closed communities, which are mainly the virus, norovirus. Then also the rotavirus rarely caused pediatric diarrheal outbreaks, can be vaccinated for, and then hospitals which also cause infection known as nosocomial infections, which occurred in the hospitalized patient. So concentrated enteric infections. Nosocomial infections are the cause diarrhea. Hospitals, some people who are admitted in the hospital and they develop the diarrhea, those as the nosocomial infection or diarrhea. Then we have Clostridium difficile causes nosocomial diarrhea. It causes the diarrhea among adults, significant diarrheal illness. Then we have Klebsiella oxytoca, cause antibiotic associated hemorrhagic colitis. As I mentioned, some people who are on antibiotic, they can develop diarrhea also, and that's the pathogenic organism, which is Klebsiella oxytoca in people who are taking antibiotic. Then enteropathogenic E. coli cause outbreaks of diarrhea. So these are some microorganisms in which the location is important, whether they are closed community or they are the orophycal route transfer, or if they are in the hospital, if they are taking antibiotics. Different microorganisms attack in these different situations. Age, mainly children less than 5 years. Breastfed infants protected from contaminated food and water. Protection due to maternal antibodies. Solid food consumption increases the risk. Exposure to rotavirus. Common infection is norovirus. So children are very prone to infections less than 5 years. One is their immune system becomes weak. The infants who are on the breastfeeding, usually they are protected from contaminated food and water, and they are protected from antibodies by the maternal antibodies. And there is usually increased risk once the children or they start the solid foods. Another, higher infections attack rates among children as a result of enterotoxigenic E. coli, enteropathogenic E. coli, enteric hemorrhagic E. coli, Shigella, Giardia lambia, and Corynebacterium or jejuni. So all these are the different pathogenic organisms that affect the children. Host immune status, we already mentioned this status in the defense mechanism, but if the person is immunocompromised, there is increased risk of infection. Acute and chronic infectious diarrhea can occur. Cell-mediated immunity defects, there is higher risk of salmonellosis, listeriosis, cryptosporidiosis, and some other enteropathies. So all these are different microorganisms. If there is decrease in the cell-mediated immunity, these different microorganisms can attack and cause disease like salmonella, listeria, cryptosporidia, and some other common microorganisms that can cause enteropathies. Bacteremia, raised toxicity, metastatic seeding of infection caused further damage. Bacterial food poisoning, indication of non-inflammatory diarrhea. So food poisoning can cause non-inflammatory type of diarrhea. Common source outbreak, clues to bacterial causes. Now some bacterial food poisoning, the incubation period, symptoms associated, and common food which cause that food poisoning. If the incubation period is the period from the entry of the microorganism and the appearance of the first symptom or illness. So incubation period, if it's 1 to 6 hours, the organisms are Staphylococcus aureus and Bacillus cereus. So they cause common rapid illness, Staphylococcus and Bacillus cereus. Nausea, vomiting, diarrhea, and the food that cause it is ham, poultry, potato, egg salad, mayonnaise, cream pastries, fried rice. 8 to 16 hours, Clostridium perfringens, Bacillus cereus, present with abdominal cramp, diarrhea, and usually vomiting is rare. Food that can cause is beef, poultry, legumes, gravies, meats, vegetable, dried beans, cereals. So different food have different effect. Then more than 16 hours now, Vibrio cholerae, watery diarrhea, shellfish, water, enterotoxigenic E. coli, they also cause watery diarrhea, salads, cheese, meats, water, enterohemorrhagic, bloody diarrhea now, ground beef, roast beef, salami, raw milk, raw vegetable, apple juice. So different foods can cause different illnesses and different pathogenic organisms are associated. Then we have salmonella. It causes inflammatory diarrhea, and usually beef, poultry, egg, dairy products is salmonella. Campylobacter jejuni, inflammatory diarrhea. Shigella, dysentery, Vibrio parahemolyticus, dysentery, and the common food sources are also mentioned: vegetables, potato, egg salad, lettuce, mollusk, and all these are the foods that can cause the food poisoning. The important is very fast, 1 to 6 hour is usually the Staphylococcus Bacillus cereus, and the person has nausea, vomiting, and diarrhea. Bacterial disease is usually, bacterial food poisoning is caused by the enterotoxin produced by bacteria, Staphylococcus aureus and Bacillus cereus. Shortest incubation period 1 to 6 hours, usually lasts less than 12 hours. So fast onset, rapid recovery is there. Staphylococcal food poisoning is due to it is contamination from infected human carriers. multiply at wide temperature ranges, cause diarrhea, nausea, vomiting, and abdominal cramping. So these are some differentiating features between the Staphylococcus aureus or Bacillus cereus, and then also staphylococcal food contamination. When we consume the contaminated food, abdominal pain is also present. Next, Bacillus cereus is another bacteria that can cause really rapid infection within 1 to 6 hours. Emetic form is a syndrome with short incubation period mediated by staphylococcal type of enterotoxin, longer incubation period 8 to 16 hours. Associated with contaminated fried rice. Diarrheal form. So only if the vomiting is present after the Bacillus cereus infection, usually the incubation period is long, 8 to 16 hours, and it is also because of enterotoxin like Staphylococcus aureus. Next, the diarrheal form is enterotoxin resembling E. coli, which is the labile type. Diarrhea and abdominal cramps are present. There is vomiting, which is not common with the diarrheal form. Next, the food poisoning, which is caused by Clostridium perfringens, slightly longer incubation period, heat-resistant spores, toxin produced in intestinal tract, severe abdominal cramps, and then there is diarrhea. So food poisoning by Clostridium perfringens is mainly by the associated with severe abdominal cramps, and incubation period is longer, about 8 to 14 hours. Capsaicin in hot pepper cause food poisoning as well. So that was all about section 4. Thank you for watching sqadia.com.